Today we will talk about the microsphere pivot, the normal sphere pivot, and also the OT equator solution. Those are the micro pivots that are available in 3 different lengths: 7 mm, 9 mm, and 10 mm of the cone. Every length is colored differently. We have the metal, this one, the metal color, the purple color, and the green color. All the cone are identical, and you can use a Moser bar. This one is a traditional bar for the endodontic treatments. The same bar can be used also for the normal pivots. Again, we have 3 different lengths, so 10 mm in green color, 9 mm in purple, and in gray color, metal color, the 7 mm. All those pivots will be inserted into the root, inside the preparation already made. Of course, Dr. Baccaro surely show you how to treat a root. This is not my job, I am a dental technician, but I will let you see how you can cement and then, of course, insert into the denture a retentive cap, so to stabilize the denture inside the patient mouth. Okay, let's start with the normal pivots. I remember that the head of the normal pivots is 2.5 millimeters. The head of the micro pivots is 1.8 millimeter. Clearly, also for the micro pivots, we have the retentive caps. So for the 2 diameters, 1.8 and 2.5, we have the 1.8 retentive caps plus the metal housing. And for the 2.5 spheres, we have the 2.5 retentive caps and the metal housing. We will talk later about the OT equator pivots. Everything that I'm showing you is available, of course, in packaging. So, for example, here you can see our package for the normal pivots, 7 millimeter. Okay. Normal pivot, 7 millimeter. And after, you can find also a packaging with a sphere with a diameter of 2.5, okay, for the normal spheres, with all the caps, the housing, the metal housing, and also a protective disc. Later, I will show you the reason of this protective disc. And last but not least, two more products. The ring, the directional ring that I use for the positioning I use for the correct positioning of the caps inside the patient mouth, and the transfer or the impression coping, better called impression coping, for the management of the pivot and also for the, of course, impression taking. So let's start. So just to just consider one thing. This is the bar for the roots. Today I'm working with a plastic model, so I will not use this one. I will use a bar for the model, which has the same shape, but is made for the plastic. Of course, we have also a kit for the Moser bar. Okay, so Rene T3 gives you everything you need for the processing of a patient with the pivots. Okay, let's start. Okay. After all the endodontic treatments, I will just make a proper hole for the pivot, because I need the pivot to be passive, that goes into the root, and it should be passive, but not too loose. So that's why we give you the proper bar to treat the root. And now I need to see if the pivot, lo sharing però è stato bloccato. I need to see that the pivot will, okay, sorry, we lost the image. Anyway, I need to see now if the pivot will be passive into the root. I need the impression copings for this, and the gray ring, okay? The gray ring, I need this because it's the 0-degree ring. I put it onto the head of the sphere. I need to insert first the wider hole of my ring. Every ring, the gray, the green, and the red one, has, of course, 2 holes, and the biggest one should be inserted first onto the sphere. After that, I just take the impression coping, okay, and you can see that the gray ring is a 0-degree ring, so the impression coping is perfectly in axis with the pivot. I insert it into the root, and I just check that it can go at the very end of my preparation. Okay, there is a thin air in between the two, so I just remove my pivot and I proceed with the root preparation. Of course, with a plastic model, I can go very quick, but with a real patient, you have to be careful to pay attention to the correct length of the root. That's the reason why we produce 3 different lengths of pivots, 7, 9, and 10 millimeter, accordingly to the root to be treated. Okay. Again, and I can be satisfied because the pivot goes inside the root. I'm satisfied, and is passive without being too loose. Okay, so I'm happy of this. I will check also the other root. Okay. Okay. I'm happy because also here I can go deeply to the very end, so that's fine. Now, we need to make some notches on the cone of the pivot, because originally this is a smooth, okay, cone. It is very straight, has no notches, no retention, because I can use this pivot in both ways. In one way, it is provisional, or if I create some retention, I can use it as a definitive pivot. So for your benefit, I will produce some notches in one of the two pivots because I already have prepared one. So I can use directly the tweezer. Okay, I take the tweezer, the pivot with the tweezer, and I produce some notches with a diamond burr or also carbide burr. I would recommend a diamond burr, but anyway, also a carbide works properly. Okay. I produce some notches, some retention into the pivot. Okay. Again, gray ring, impression coping, and okay, I'm ready with this pivot. I have the second one. And now I need a cement to glue, to fix the pivot into the roots. We have this kind of product. We have a we made a selection of composite cement. This is a dual cure composite cement, and in a self-mixing syringe. Those syringes have a tip that I will insert into my syringe. Okay. And I start to cement my pivots. Okay. I fill the hole into my root. Okay. And now I proceed with the cementing of the pivots. As you can see, the gray ring do not allow the pivot to go too deep into the root. So that means the gray ring will allow me to protect all the undercuts of the attachment, giving away the composite cement, but also allow me to not to allow the pivot to go further into the root, so not too deep, but at the correct height. So I wait 3 minutes of the curing, for the curing of this cement, and now I will talk about a bit of the OT equator pivots. We have again, as before, the 10 millimeter, the 9 millimeter, and the 7 millimeter. Here we have a low profile attachment, and we have some new features. First of all, this pivot is a definitive pivot because it has some retentions on the cone. I don't see the color for. As you can see, compared to the spherical one, both normal and micro, compared to those two, 1 and 2, that are provisional or adding some notches, some undercuts, I can transform in definitive. So compared to those two, the OT equator pivots have retention on the cone, so they are already definitive pivots. Okay. The second feature is the head. Here I have a low-profile head, which is covered in gold color. Of course, this is not gold; is a nitride coating of titanium. This means the head of those pivots are very strong and very hard and will last over time. That's why they are considered definitive pivots. Those pivots have their correspondent retentive cap. Every different color means a different retention, from the weakest to the more retentive. And just one suggestion, never start with the strongest retention. Always, depending on the amount of attachment you have into the mouth, you can choose between the weakest if you have more than 2, let's say 3, 4, or even 5. If you have just 2 attachments, you can choose the pink one or the transparent one. I will not suggest to start immediately with the strongest, which is the pink one. Let's manage the retention over time, okay? Don't be anxious to give the best retention, because 99% of times patients do not need the strongest retention, okay? This said, we insert the retentive cap, the plastic retentive cap. By the way, these are all biocompatible. Sorry, those caps are all biocompatible to stay in the mouth. so they are safe and they are approved. All those caps can be inserted into a metal housing, which can be stainless steel or titanium, or in the brand new metal housing, which is called Smart Box, that later on I will show you. This is the traditional stainless steel or titanium, also available in titanium, and this is the Smart Box, which is a very smart device that can help you to correct up to 50 degrees of divergency between two implants, so 25 and 25. I said implants because we have also OT Equator available for implants. In this case, we have OT Equator available for roots, so they are pivots, but the system is the same. The retentive head is the same, so also the caps can be used both on the pivots or on implants with OT Equator head. So I guess 3 minutes are over, and I proceed in removing the impression coping very easily. They are snapped on top, so they can be removed very easily. You can notice that they have a yellow cap, so the weakest one, so to better manage the removal. And then after, I can remove also the rings. Okay. You can see how the spheres are clean of cement, okay? That's the duty of the work of the ring, okay? This ring allowed me to leave the neck of the sphere clean of cement. It's very important part of the work. Now we will use the other two rings. The red one, which is of 14 degrees, is angled with 14 degrees, and the gray one, the green one, which has an angle of 7 degrees. I will show you why they are angled. This is a sphere. In this case, is a sphere for implants. But again, as I told you before, we have spheres both for pivots, such in this case, or for implants. No matter the implant, we can produce the spherical or OT Equator abutment. So we need to correct the divergency of the implant, for example, or, as in this case, of the root, because the root has its own direction, and we need to stick to that direction. We need to adapt to that correction, and what we do, we put a ring that here you can see has an angle, and then on top a cap. The thing is, I need to place the head of the cap as much as possible in parallel with the occlusal plane of the patient. Okay. So let's think of a situation like this with an upper jaw. I need to put my cap later, I will show, as much as in accordance, in compliance with this plane, okay, which is the occlusal plane, okay, this one. Because in this way, the cap will work the best, at their best. I will have a look on the divergency of the two pivots, and I see that this one is more tilted, so I will choose the red one. This one is less tilted, and I can choose the green one, or even the gray if it's completely straight. Anyway, I can also use, for example, two red rings, and I will, in this case, I will use two red rings. How they work? They work with the protective disc I mentioned you before. You put the protective disc on top of the ring. Okay, in this way, and then I will now insert the retentive cap into the metal housing. With this tool. This is a tool that is an extractor. This is a hook. I'll show you later how to use it to remove the retentive cap once it's inside the metal housing, or an insertion tip to insert the retentive cap, okay, into the metal housing. I guess you heard the click. Again. Okay. Okay. We try to imagine that this is my patient. Okay, I have an occlusal plane, and you can see that the two metal caps are going one left and one right. Then I just need to make what I've done before. I will turn the ring and try to correct as much as possible, because I can do the best I can, but I will try to make the best in my power to do. Okay. This is the main part of this work, because I need that the two cap work as much as possible again in parallel between them, and that they are in compliance with the occlusal plane, okay, of the patient. This is the best I can do. Okay. This one is okay. This one still have a divergency, but no problem, because I have a sphere. So my cap will go in any case in contact with my sphere because it's round. Okay. Just for my plastic patient, because I have a plastic patient here, I need to use some Vaseline. This is not needed in the mouth, so you don't need to make this in the mouth. I put some Vaseline here because I will insert later on some liquid resin into my denture, and I have the risk that they will stick together, the model and my denture. So again, do not do this at home, basically. Do not use Vaseline in the patient. You don't need it. I should put a do not try this at home logo in this moment, but maybe for the next webinar. So I'm ready, and I need the resin for my denture. Okay. I forgot to check one important thing. I was forgetting one important thing. We need to verify if we have enough space into the denture, because I already prepared this, but I need to verify if I have enough space for the two metal housing. How I can do this? Simply with a red lipstick, very smart way to see if we have all the available spaces. I just mark the top. I don't need to make everything red. I just mark the top of the metal housing, just the top, and I will see if I have all the room in my denture. I think no, because my denture is quite high, and in fact, I have some red marks here and a little bit here. What I do, I take a bar, for denture, and I drill a hole. Okay, I made some hole a little bit wider, and I check again if I have my space. I'm not sure, but it seems that everything is okay. No, it's okay. I have all the space. My denture do not move anymore, so I'm sure that my denture is adherent to the, no, just a bit here, just a little spot. Okay, that's fine. Now, this is just a trick. I produce with a conical bar 2 little holes here, where I produce the space for my housing. I just produce 2 little holes that will go, you can see, in the palatal side, but just a hole of around 1 millimeter, no more, okay? From the top of the hole towards the palatal side, okay? Okay. This is because I need that the liquid resin will flow in a neutral part of the denture, so not to create some wrong placement of my denture into the mouth. So to be sure that the denture will sit completely over the gingiva. Okay, now I can proceed with the denture. I will just moist the denture with the liquid for the acrylic resin. Okay, and then now I can proceed with the mixing of the resin. Okay, I just wait for the resin to become plastic. I do not like to work with a very liquid resin because it runs everywhere. So this is too early. Have a look. That's too early for me. I just wait a few seconds. That's okay. Now that's okay. I can manage the resin. You can see it's plastic. It's not too fluid. I can do whatever I want with the resin now. I can manage it with precision. I can put it where I want to. Otherwise, if too liquid, the resin will flow everywhere. And I do not like this to happen. I need to remove the red lipstick from the housing, and I can go with the resin. I will ask my plastic patient to close the mouth, but of course he is not able to, so I need to use some elastic. But actually you should ask your patient to close slightly the mouth, not too much. I do not need to stress the attachment, okay, in this moment. And I can check a bit of the resin that come out from my hole. I can check which is the point of hardness of my resin. Because never forget that the resin will cure more quickly in the mouth compared to the one that I have here. Anyway, I can also have a look at this resin and wait for it to cure. It's almost there. But now we will proceed, waiting for the curing of the resin, we will proceed with the pivot of the equator, okay? Because now I want to show you also the system for the two equator pivots. 1 and 2. Again, the same thing. I will check first how my pivot will fit into the root. In this case, I do not use the gray ring. Do you remember the gray ring that I used with the spherical pivot? I use this with the spherical pivot. With the OT equator pivot, I do not need the ring. Okay? I just have the pivot and the impression coping. Very easy, very simple. I will check. Not yet. I need a little more space here, and I think the same here. Yes, I need a little more space here. Okay, the pivot is not completely seated. Of course, I'm doing all the steps with calm and doing every step slowly. In the dental cabinet, everything will be more quick, okay? I'm just showing you all the steps, repeating them and doing them slowly. But the second case you will do in your life, you will notice that is a thing of 20 minutes at the most. Okay, I am almost satisfied. Okay, and now I will cement also the pivots, OT equator pivots. I need to remove the former tip because it has the hard cement inside. I put a new one and I go again as before into the root. Okay, I just had a little bubble, but I managed to remove it. Also here, okay. As you can see, it's very accurate with the proper tip. And then I go with the cementation of my pivots, okay, the equator pivots. In this case, the impression coping will be the stop of my pivot into the root. Okay. I wait. I take the model with the spherical pivots. I will remove the Vaseline I put into my onto my plastic patient. Again, this is not a thing you need to do in the mouth. And I just remove my denture. Great. Okay. What I have here, the protective disc, I remove them, 1 and 2. And also the directional ring. I remove them, 1 and 2. Okay. And again, I need to remove the Vaseline from my plastic patient. Oh, by the way, the plastic patient is the best patient you may have. I can assure you. It's very friendly. He opens wide the mouth. And here I have my 2 retentive caps into the denture, okay? I just need to refine just a little bit my denture, because my protective disc and also the red ring, also in this case, do not allow the liquid resin to go into the undercuts of my sphere, okay? So, there is just a little amount of resin here. Okay. Okay. Okay, fine. I finished to clean my excess of resin. Again, if I use the resin that is not too much liquid, I will manage everything and I do not have to correct a lot my denture. Here I have just a little bit to smooth, to make smoother the inner side. Of course, in the dental practice, in the dental cabinet, I will use also a gum, a rubber curve to make it more smoother, but just to give you the idea of what you have to do. And then after this, I just need to connect the spheres. Okay, that's my denture, okay, which is stable and do not go everywhere, okay, it's very stable. So you give retention to your patient, but it's still removable, okay? We'll have a look to our OT Equator pivots. Let's see how they work. 1 and 2. Also here I have the cement that jumps away very easily because I have no excess of cement around my attachment. Yes. Okay, I just refine a bit. Okay, I don't need to make any further action. And now I will introduce you the smart box. The smart box is a it's here. The smart box is a metal housing, okay, for the OT Equator. Again, here I have an OT Equator for implants, okay. Again, we can produce OT Equator both for roots with the pivot or for implants, okay, with the OT Equator for implants. But the thing is, the system, the attachment is always the same, okay? And the smart box is this one. I have a double housing in titanium with a inner tilting device, okay? You can see it can tilt in all directions. And this helps me to compensate the inclination of my attachment. So if I have an implant or like here I have a root that has its own divergency, I can correct it with this device, okay? I can correct up to 25 degrees of divergency, okay? So in a case with the two attachments, I can correct up to 50 degrees. I will show you the smart box. It comes into a set with all the retentive caps inside. I have the different retentive cap and the actual, the proper piece. It comes out from the box with a black positioning cap, ok? Fai un po' lo zoom, scusa. No, non muovo io. You can see it has a cap inside, okay? So it should not be removed in this at this moment. I will put just a I will just put the protective disc on the OT equator as before. No directional ring, I don't need them. And I will just apply directly the smart box on my head of the OT equator pivot. Here I want to use the traditional metal housing. And again, with my insertion tool, I will take the retentive cap, OT equator retentive cap, and I put it into the metal housing. I place the other protective disc, and again, no directional ring, nothing in between. I do not need to correct the divergency. I put the metal housing with the retentive cap. I need also in this case to check if my denture has enough room for my housing. I just color with my red lipstick the head of the housings. Okay, they are in red. And I check my denture. Oh, I notice that my denture moves a bit around the attachment. And yes, that's correct, because I see here that I have some red spots. Okay? I have some red spots, okay, into the denture. I will remove them as I've done before with a burr. I check again. Okay, I already see that my denture is more stable, so I expect not to have red dots. That's correct. I have nothing marked in red, except for here, just a little point of red here. But it's okay. I need to make the hole for the excess of grazing again from the top to the lingual part. Okay. Again, as before, okay? 1 and 2. The lingual part. I remove the red lipstick. Okay. Again, I need some Vaseline for my plastic patient, not for the real patient. Just a few seconds and I am ready. And I proceed with the resin to be made. Okay. I wait just a few seconds for the resin to be more in a plastic. That's fine, you can see. That's okay now. And I ask the patient to slowly close the mouth. Okay, the resin is still not hard. We wait some more time. And in the meantime, I will show you also the kit where you can find the pivots, the Equator pivots. This kit has two pieces of yellow cap, metal housing, protective disc, two pivots. So basically, with one kit of these, you can do a case like this one with two pivots. You have everything in one kit. If you want to the smart box, you can have them separately. Depends on what you need actually. Okay. I repeat, the smart box is a metal housing, titanium housing that allow you to correct up to 25 degrees per implant. Okay, I think not yet. Still a bit tender, softer. Sorry. By the way, in the meantime, we wait. I show you how you can also take an impression only for the Equator pivot with a titanium impression coping. So basically, you have two options. You have this one with the Equator. You have the impression coping with the yellow. The impression coping with the yellow cap, or also one that use the screw that you find inside the Equator. You can use both versions. For our purposes, it's this one will fit you well, because you can see that your Equator has an internal thread. So you can also use this one if you prefer. Okay. You can have also this option. Okay. As you can see, your Equator pivot is a product we had since 5 years, while the spherical pivots we had since 1983. This is the year of foundation of the RAIN 83. So we were founded in 1983, and we had the spherical pivot since then. Of course, the Equator pivot is a more updated product and has more option to offer. Okay, we have now let's see what happens. Okay, we have the two Equator pivots. into the model, into the roots. I remove the Vaseline. And I have the OT equator, okay, perfectly cemented into the model. Here we have the protective disc that I remove, and below I have my retentive cap fixed in the denture resin 2. And here I have the smart box with a black cap. I need to refine my denture and take my part. And now I have my black cap into my smart box. Okay. Again, I need to use the hook of the extraction tip of my glue handle. Okay, I can use it both ways. And also the tip has two options. The micro tip for the micro cap. I'll show you. Okay. For the micro cap, or for the normal cap, or the same tip for the OT equator. Okay. So with one tool, I can manage everything. Now I need to remove the black cap of the Equator Smart Box, which is a positioning cap. I refine around with a burr, and now I can remove. You can see it's very easy. This is a hook. I just put it into the cap and I remove it. Okay. And now I will insert the pink cap at the equator. Just remember that every time that you have some liquid resin around the smart box, you should remove the cap you have into. You should remove the cap and put inside a new black cap, okay? Because every time I have liquid resin around a smart box, I need to close the system, okay? So after I have done my processing thing, I take out the cap. I take another one because every time I remove a cap from the housing, I will destroy it. I take one pink equator cap and I put it into the denture very easily. And I put it into my mouth. You can see. This way, I can offer the patient a attachment which is better than a hook, because sometimes people ask me, okay, but why I need to put an attachment into the mouth? To provide something better to the patient, because otherwise, if you have a removable denture, you have two options. If you have one teeth, you can produce a clasp, sorry, not a hook, a clasp, to anchor the denture into the mouth, or you can put a attachment into the root. In this way, it's more aesthetic. It's easier to manage, because if a clasp loses the retention, you just need to go with this and to try to bend the clasp. But very often you can break the clasp. So basically you avoid all the benefit of this clasp. While in this case, you just need to remove the retentive cap very easily, and you change it. Sorry, you change it. Okay, you choose the color you need, and it will take you 5 seconds. No, okay, I will be fair, 30 seconds, okay, not 5, 30, but you break nothing. It's very easy to do. You have all the instruments, and you offer something better to the patient, okay? So, I finished. I thank you for your attention, and please connect to our website rain83.com, where you can see all the other webinars of my colleagues, of the doctor, like Dr. Vaccaro that I really thank for the introduction to this hands-on for his precious lecture. And I invite you to follow us also on Facebook and on our website. Thank you so much.